Hi everybody, I'm Kevin Johnston. I'm a senior account manager here with Banner Aetna, and I live with my wife and our 3 small children in Chandler. By show of hand, who else lives in the East Valley? Anybody? A few? How about Scottsdale? Where's my Scottsdale people? Yeah? How about Phoenix? All right, West Side, anybody represent West Side? There we go. So we live here, we work here, we understand that Phoenix is a big and it's a diverse community, and I'm excited to tell you today how Banner Aetna as a joint venture is addressing the different needs of our members based on where they are here in the local community. So I'm going to encourage you to think for just a second, how are the healthcare needs different for the Gilbert new moms versus a resident of Sun City, where, if you can imagine, this is true, 4 out of 5 people in Sun City are older than Frank Benedetto. This is not a hypothetical. Give me some real examples of what are the different resources and care needs for different populations. Who's got one?
Durable medical equipment for elderly folks in Sun City.
Walkers, absolutely. That's a great example. Anybody else?
Maternity.
Maternity, for sure. Is that yours?
No, breast pumps for new moms.
Well, that's all connected. You're right on. So what Banner Aetna has done as a joint venture is taken a step back to first identify and figure out what are the differences in the different communities that we have here locally, and then how do we address them with smart strategies. So think for just a second. Besides age, so we talked about age a little bit, what are some of the other differences within these different parts of town? So it could be cultural, language, absolutely.
How about knowledge about medical services?
Sure. How about
Access.
socioeconomic factors,
Yeah.
social determinants of health? These are all reasons why we need to identify how our population is different and build the healthcare model to meet their needs. So if you could do the next slide. This is a big, busy slide. Don't worry, I will walk you through it. Now, for context, let's remember that healthcare is local. It has to be local. I guarantee you, a member doesn't really care how many total primary care physicians we have in the Phoenix metro area. They want to know that they have a good doctor who's nearby, who can treat them, and who can see them soon, right? So it's a very local interaction when we deal with the member. And let's also think about what is the status quo of where the resources are throughout our valley. It's market driven. You know, Fred the podiatrist thinks it would be good to set up shop here because there isn't another one in his strip mall, right? But it's market driven, you know, supply and demand, and what doesn't work fails. But it doesn't necessarily mean that it's smart, top down, strategic building and planning of resources. So what Banner Aetna has done, we've separated the Phoenix metro area into 8 different neighborhoods with what we call our neighborhood care model. Now, each one of these 8 different neighborhoods has a medical director that leads this team, all right? And it's a team of medical professionals. Who are the medical professionals? It's a great question, I'm glad you asked. So, we've got primary care and specialists. We have quality control, clinical examiners, pharmacists, all the different moving pieces of different kinds of care that we want to pay attention to. And then that team is responsible for reaching out to the physicians in their area to make sure that they are meeting quality and efficiency standards, to show them what other people locally are doing well, and they're actually incentivized to engage and participate in that. All right, so we've talked about how Phoenix it's a diverse, big population, why the status quo is ignorant. It includes waste, inefficiencies. Ultimately, that costs everyone more money. It costs more money to health plans, it costs consumers more money. It leads to frustration when they can't get access to the care they need because the system is not set up to meet their needs where they are. The real challenge is to find, I said it real well, hang on, what care works where. That's the goal. What care works where here within our local market, because we live here, we work here, so do these physicians. They know the local area. That's why we're able to design and build this smarter than Aetna 3 years ago, and then the rest of our competition, if they're not paying attention, using local resources like we've done here with the joint venture. That's all I got.
Awesome.